Hi, if you've just had surgery with us for a mid-urethral sling, here's what to expect for the first 24 to 72 hours. The most common type of surgery sling we do is a single incision sling. So this has one incision in the vagina. Because of that, you may have some vaginal spotting or bleeding, like a light period. If you're soaking through a pad an hour, that's a reason to call the office and let us know. The sling anchors underneath the pubic bone in the muscles there, so you can have pelvic cramping or cramping in the groin muscles. That is typically best treated with thyme, ice, ibuprofen, Tylenol, and that can help reduce that swelling and aching in the muscles. An important thing is that we do want you to be able to pee after the procedure and not feel like you're really having to strain or push hard to pee. So really monitor how you're peeing after the procedure. Your stream may be a little bit thinner and lighter, but it shouldn't be so little that you're just dripping without getting a full stream. You shouldn't have to feel like you're having to push it out. In fact, the best thing to do after the sling is really to allow your bladder to do the work. So when you are trying to pee, sit on the toilet, relax your muscles, and let the bladder squeeze the pee out. Don't try to push it out yourself. If you're having trouble emptying your bladder, you feel like you're persistently not emptying, that's a phone call that you need to make to our office so that we can assess that a little bit better for you. Fevers, chills are not normal after surgery. If that was to occur, we'd need a phone call. And then the faster that you can get back to having normal bowel movements and a normal bladder cycling, all that's very important. So try to just keep your bladder on a schedule, pee every 2 to 4 hours. Try to stay on the stool softener to get those bowel movements back to normal, and that will all help you feel better sooner. If you have any questions beyond that, please give us a call.